we've got an ageing society, and if we're going to have more and more of us living healthier for longer, we've got to take a carrot and a stick approach to healthy ageing. I think what that means is we're going to need to incentivize us to be good, you know, find ways, whether that be financial incentives, insurance incentives to encourage us to do physical activity, to eat the right foods. But we've also got to take the stick approach as well, and what that might mean is a bit of use of regulation, a bit of use of tax to discourage. Let me give you 3 things that I think we need to do to improve uptake of adult vaccination. Firstly, we need to engage employers. We need to actually get employers offering vaccination to their staff from their 50s and beyond, and build up the social norm. Secondly, I think we need to make sure that health and social care workers are vaccinated. If they're not setting the right example, then we're not going to get the rest of the public to do so either. And thirdly, we've got to make sure vaccination is really easy to access. In the UK, you can access flu vaccination, for example, through a pharmacy. We've got to make sure it's not too much of a drag for people to get the jabs they need.
Future.
The potential big disruptor, say, for example, in the context of adult immunisation, might be big data. We're starting to see, for example, companies using things like location-based services and combining it with social media to, in effect, map and track disease progression. So, for example, what companies are starting to do is look at where people are reporting that they might have a cold or a sniffle, and using that to say, well, actually, you know, there's an issue in this bit of the country. Perhaps in the future we might see, you know, the delivery of vaccination services not based on age, but on where you live. I think that health across the whole of Europe has got a huge challenge. How can it become sustainable in the context of an ageing society? We know that we have to improve health productivity. The cost of health increases, and so does, because of new technology, and so does the demand. The real challenge we've got is if you want to move healthcare systems towards prevention, what it might mean is taking some funding away from acute services. And one of the issues is, of course, today's pensioners, today's older population, rely very heavily on acute services, on services today. It's tomorrow's older people who will benefit perhaps more from prevention. So you've got a real political challenge for governments of how do you stop doing things you know actually in the long run aren't in the best interest of public health when they're very popular amongst a population which after all votes quite heavily.